Welcome, and thank you so much for joining us this afternoon for this conversation on the electoral aftershock, what's next for health and social equity. My name is Kim Tabari, and I'm part of the USC Equity Research Institute. We would love for you all to introduce yourselves in the chat so we can get a sense of who's here, name, pronoun, whether you're a student, faculty, staff, community member, your major, your department, anything that lets us know who you are. That would be great. Thanks for putting those things in there. Hi, Ezine. Um, and a little bit of housekeeping and accessibility. You can enable closed captioning by clicking on the live transcription button at the bottom of your screen if that's something that you need. Alrighty. So before we begin today's conversation, I want to acknowledge that we are at USC on the ancestral and unceded territory of the Tongva people whose ancestors ruled the region we now call Southern California for at least 9,000 years. Indigenous stewardship and rightful claims to these lands have been voluntarily relinquished. We pay respects to the members and elders of these communities, past and present, who remain stewards, caretakers, and advocates of these lands and river systems. The areas surrounding USC's two main campuses were until about 1800 principally oak and riparian woodlands and prairie flower fields. Intensive landscape management by the Tongva village yielded an abundance of acorn, seeds of annual herbs like chia, and numerous birds, animals, and fish. Indigenous peoples of Southern California survived through three conquering regimes and still thrive today in an unbroken chain linking the past to the present. We really want to recognize this history. We must also grapple with what it means to live on stolen land, understand our role and responsibilities as guests on Native American lands, and commit to supporting the struggle for Native nations' sovereignty and self-determination. We share these acknowledgments for three reasons. One, to pay respect to the original caretakers of the land, past, present, and future generations. Two, to raise awareness about histories that are too often erased or forgotten. And three, to affirm our commitment to racial justice and social change. So please take a moment, stop whatever you're doing, notice the ground beneath your feet. Take a deep inhale and a slow exhale, honoring the land. Thank you for getting grounded and for offering appreciations to the land, and to those who continue to fight for land and recognition yesterday, today, and the future. Thank you. So, we are here first and foremost to be in community with one another, to connect, to learn, and to support each other. Your presence is a testament to your commitment, not only to yourself, but to your fellow community members. This moment is an opportunity to reflect on the health and social equity implications of what our city, state, and country may look like under this new U.S. administration. Together, we'll explore how these changes will impact our communities and the work that lies ahead. We are fortunate to have four amazing faculty members here today, each of whom works closely with diverse communities, many of which will be impacted by the national changes. In a few minutes, you'll hear from them as they share their insights and expertise. But before we dive into the conversation, we'd love to hear from you. How are you feeling post-election? What is your emotional temperature today? We'll drop a link in the chat if it's not already been done. Yep, there it is. Please click on the link and write a few words to describe how you're feeling today in the wake of the 2024 elections. So if you're on your phone, it should be easy to hit the chat button. You'll see the link in the chat. It's a Menti link. Click on that link. I'm going to do it also. Clicking on the link. And it'll come up and you'll just enter three words or one, whatever you're feeling. Give you a minute. All right. We got some words coming in. Give it a couple more minutes. We got at least 75 people on this call, so we want to see those words. All right. Thank you. Your input is valuable and it really will help shape our conversation today. And please know there's no right answers at this moment. And this conversation really also sprang up from our panelists' own wonderings about what happened and what to do. So we're figuring this out together. So we're truly inviting you to be in this conversation. If you have any questions along the way, please put them in the chat. We're going to do some text mining and pull out those questions later on. And so I just want to say a couple of the words that I'm seeing on the screen. Folks are anxious, they're worried, they're concerned, uncertain, they're numb, overwhelmed, disappointed. And then I see some determined, petrified, ambivalent, depressed, lots and lots of feelings. Thank you so much for sharing that. And if you haven't had a chance to, please continue to do that as we um, continue our conversation. So I'm going to read just a high level blurb for each of the panelists that are as they're spotlighted. The team will drop bios into the chat so you can read more about them, or else we would be here for a couple hours hearing each of their bios. They're all amazing. I'm going to start in alphabetical order with Ricky Bluntenthal, sorry, I'm messing up your name. Bluthenthal,
Blumenthal.
there we go, Bluthenthal. I know I was practicing it too.
Okay.
Ricky is a distinguished professor of population and public health science, associate dean for social justice, interim chair for the Department of Population and Public Health Science. Welcome, Ricky. Sophia Gruskin is also a distinguished professor of population and public health science and law. She is the director of the USC Institute on Inequalities in Global Health. Welcome, Sophia. Viet Nguyen is a USC Errol Arnold Chair of English, Professor of English and Comparative Literature, and a Professor of American Studies and Ethnicity. Welcome, Viet. And Manuel Pastor is a distinguished professor of sociology and American Studies and Ethnicity and the director of the USC Equity Research Institute. Welcome, Manuel. Welcome to this conversation portal as we invite ourselves and our ancestors in with a breath. So let's jump in. So on November 5th, we had an election here in the US, in case folks didn't remember. It was a long time ago, it feels like. And many of us in this room were not thrilled by the results. We titled this conversation Electoral Aftershock. Some of us are still in shock, and many of us have a plethora of feelings, as we just saw from the audience poll. Our panelist has authored numerous books and written hundreds of articles, which makes them expert in their respective fields. So I'm going to start with Ricky. Ricky, given your deep commitment to health and social equity, particularly in the area of harm reduction, do you fear that we're entering this new era of cruelty? What are your most pressing concerns about what the election results means for the people and communities you work with?
Okay, so probably not a new era. I feel like, particularly when I think about it through the perspective of the people I want to be in solidarity with, or folks who use drugs and people who are unhoused. Um, the sad truth is that even though there had been progress, mostly at the local level and somewhat at the state level, in terms of making distilling the truth of harm reduction, which is that, to help people, you have to help them. And the way, giving people access to resources and supplies, and attempting to address the sort of fundamental structural violence that they face, as a way of achieving well-being and uplifting human dignity. That truth, um, you know, has long been contested. And so, I mean, it's funny, because I've been doing this so long, I've had the pleasure of watching it become mainstream and then watching the backlash and the sadness of watching the backlash too, which has happened. So, the national election was awful and will be awful for harm reduction. But the local stuff was awful too. We endorsed Prop 36 in the state, and previously we've got this care court stuff coming down. All of which use carceral means to address health problems among a population that has been poorly served by those institutions historically. And the truth is, those institutions are part of the problem. So I do it's depressing, but I guess what I thought, it's a place that I have been in my entire professional and adult life. And So I won't get into solutions, but I do just want to remark in the context that this election, is part of a story of us refusing to learn that carceral approaches to people's health are bad and send us in the wrong direction, and an unwillingness to believe that caring for people is actually an effective intervention, particularly when partnered with resources. um, and um, and so I think that struggle continued and will continue. I mean, the good news, I guess, from my perspective, is that I do know, after doing this for so long, that we're right. Like, we can solve homelessness. We can prevent the spread of HIV and hepatitis C. We can end overdose deaths. But we know how to do that. We just have to continue working to implement, either legally or illegally, those services that we know that preserve life and live with human dignity.
Thank you. Thank you so much. And Sophia is a distinguished professor of population and public health with a global health perspective. What are your greatest fears for vulnerable communities, both here in the US and around the world? How do you see the election outcome shaping the struggles these communities face?
Hey, thanks for that. And I totally endorse everything Vicky just said. And I guess the first thing I just want to say is that let me just zoom out a little bit before I zoom into your question, because, health, who has access to health, it's always been political, right? And health is meant to transcend politics. But if you think about the erosion of rights protections and you think about the dismantling of public health institutions had already been happening in recent years, that's nothing if it's not political, right? So one of the things about politics then is to realize that in 2024, the US election, even though it's incredibly important, it's only one of 64 major elections happening this year. There's approximately 49% of the global population who cast their votes this year. That's more than ever in history, and that's great. But I raise it because countries like India and Russia, not just the United States, are countries whose political decisions have immense consequences for the health of people, not only within their own borders, but global consequences. And unfortunately, they've gone in a similar direction as the US election. So my point is that all of these political factors and this geopolitical dynamic are really key to shaping what will and won't be possible for health in other countries, but in the US as well. And, health is becoming, in the words of my friend Daniel Reedpath, a geopolitical bargaining chip. And that has huge implications for vulnerable communities everywhere. So now, if I can, just to answer your question very explicitly, I'm going to talk about abortion and reproductive health more broadly. And again, I need to say, we're currently in the US, and I want to express my gratitude for being in California, noting something that we all know since the Dobbs decision, things haven't been great. But I want to give a very recent example from Texas, because I worry that these are the kinds of things that are going to proliferate. They recently passed a state law that threatens physicians with prison sentences if they're thought to have stopped a fetal heartbeat. And as a result, medical professionals are waiting for the confirmed death of a fetus inside the woman before they will treat her, even if she has a potentially fatal infection of her own. Now, that's brutal, right? But that's our current reality. And so my worry is that these sorts of laws are going to expand. We know that the global gag rule, which time and time again Republican administrations have put into place, prevent foreign organizations that accept US assistance from providing abortions or related information or services, even if those services are subsidized by non-US money. And I just want to be clear of the harms that has caused. The National Academy of Sciences estimated that Trump's reinstatement of the policy the last time around led to close to 110,000 maternal and child deaths. That's last time. So the plan this time is to extend the global gag rule or as it was renamed under the Trump administration, if I can say, the Protecting Life and Global Health Assistance Policy. It's not just to family planning, not just to healthcare, but to all U.S. foreign assistance, including humanitarian aid and even government to government funding. And if you think about the devastating effects on health and the life of women in countries where this is put into place, it's mind-blowing. And I just want to say, let's not forget that the first Trump administration halted funding to and initiated withdrawal from the World Health Organization, a move that, according to Representative Marjorie Taylor Greene, no less, that he is very likely to repeat. And that is in addition to defunding UNFPA. So the impact of these funding cuts are not just semantic, they can mean life or death to people in poor communities in all the countries that receive the support. So it's not only what the US government is doing directly, but the impact more broadly that I just want to put on the table.
Thank you so much for that. Wow, that caught me in my chest. I don't know how other people are feeling listening to your words about, the number of deaths under Trump the last time and, potentially being worse this time around. Thank you for that. Manuel, so you also work closely with community organizations and foundations that are deeply invested in racial justice efforts across various areas of your research. What what are the emotional and practical concerns you're hearing from these communities in the wake of the election? What are some early signs or shifts you're witnessing that are causing worry?
So, knowing me, Kim, you won't be surprised. I've got three emotions, three uh, other sort of reactions that are more practical that are going on. So, the first, of course, and this comes up in the word cloud, is fear. We do a lot of work with a lot of different communities, economic justice communities, racial justice communities. We're very, very closely tied to people working on immigrant rights, mixed status families. And there's just tremendous fear about what this new regime is going to do in terms of the security and safety of these families and individuals. The second big emotion is loss. Uh, and I think it's a loss of a sense of safety, uh, partly because if America could move in this direction, is this really the America I thought it was? I think there's that. But there's actually really specific things as well. The Biden administration, for example, really focused on a thing called Justice 40, which was an effort to make sure that climate dollars, 40% of them, would be spent to communities that are overexposed and socially vulnerable, finally tackling environmental injustice at a sort of federal level in a serious way with dollars. People have been betting on those dollars, preparing for those dollars. Those dollars are probably not going to show up. So there's a sense of loss around policy gains. Sophia was pointing to some around reproductive rights. We may see the abortion medication, uh, you know, access to that lost at a national level or made certainly much more difficult. And so there's a sense of loss. There's also a sense of confusion, like, uh, how did this happen? Uh, why did the Latino vote swing the way that it did? Was it sexism? Was it anti-blackness? Was it the uh, inability of the Democratic Party to craft an economic message? Why did people think that a working class message was wrapped up in the rhetoric of a billionaire who claims to have been self made when he was propelled into existence by so much assets historically generated and handed down? So there's a lot of confusion about what does all this mean. So fear, loss, confusion are emotions that I'm seeing. What I'm seeing on the practical side are three things which I think are hopeful. The first is examination. As after the election, I've been asking audiences three questions. What are you feeling? What are you thinking? What are you rethinking? I asked the question, what are you feeling? because I think I'm one of the people who put up here on the feeling post-election determined. Like when I see a problem, I rush to the barricades. If there's a fire, I pick up a hose. So as my one of my friends said, I go through the stages of grief rather rapidly. But we need to actually slow down and understand that there are a lot of different feelings. And as you said, Kim, all of those feelings are valid. If you're feeling paralyzed right now, God bless you. That is a reasonable feeling. If you're feeling despondent, that is a reasonable feeling. For those of us who rush to the barricades and say, hey, let's organize a seminar, we are like a pretty weird breed. Um, so let us understand that feelings are an important part of what we need to do. But what I'm seeing that's really hopeful is examination and rethinking, understanding that our economic message hasn't really broken through, understanding that the alliances between communities of color are not as automatic as people would assume, understanding that, yes, we need to combat a masculinist message, not with misogyny, but with a positive sense of what it means to be a man in this world. That's a little bit difficult to figure out what to do, but examination. I'm also seeing preparation, partly because I spent a lot of time with immigrant communities that are figuring out what do they need to do to protect families against a potential onslaught. And then also determination. That is, that against this particular moment, and I really want to echo something Ricky said, which is this isn't new. It might feel kind of new, but if you've been working in harm reduction, it feels like uh, deja vu all over again. If you've been working on reproductive rights, there's echoes of this. There's a famous science fiction writer who once said the future is already here. It's just unevenly distributed. The threats to immigrants, to reproductive justice, to the struggle against anti-blackness, man, that's already occurring in different geographic places in the United States. It's now got more of a permission slip nationally, but it's not brand new. So, how do we re-examine? How do we get prepared? And how do we get determined? And for
Thank
that,
you.
we need a little bit of poetry. And so I'm glad we're turning next to a writer.
Yes, thank you so much. Ooh, what a nice intro you got there. Yes. So, Viet, as a faculty member, a Vietnamese refugee, and a best-selling author, how do you see the role of writers in this turbulent time? What sort of responsibility do we have to amplify voices of resistance and solidarity and, the ease the rising tension? Give us the tea. You're on mute though. You got to unmute.
Okay, so I just have to say that I'm a failed poet. That's a terrible introduction, Manuel. I think of myself more of as a successful prose writer. But we're living in a time in which we are we're an anti-intellectual country in a lot of ways, and we see
Yeah.
manifestations of that in things like the book banning movement in this country, which is a terrible thing in most ways. But one of the positive signs is that it indicates that books actually matter. Stories matter, voices matter, narratives matter. And we know this because we've been fighting culture wars in this country for a very long time. But of course, the very idea of a culture war became central to many of our political conflicts starting in the 1980s. And I think we're still seeing the extension of the culture wars over what is the meaning of this country, what's going to be being taught in our universities, what is our curriculum, what's going to be in our libraries. So as a writer, I take hope in that our books and our stories matter so much that other people want to suppress them. And what that also indicates is that the political battles of our country are not only about the electoral issues and the economics and the equity and all that very important stuff, but the political battles are also about the narrative of the country. What is the story of this country? What are we going to tell ourselves, and what are we going to tell our fellow citizens and the voters? For me, powerful narratives are characterized by two things. One is clarity, and the other is complexity. And for me, I achieved my own personal moment of clarity about the narrative of this country because I believe that we have a fundamental narrative that goes back to the very origins of the country. And that is that we are a country founded on beauty and brutality. Beauty, the diversity, the liberty, the democracy, the equality for some. The brutality, the genocide, the enslavement, the colonization, the war that made the beauty possible. It's having clarity about this that allows me to think that I'm not surprised that we had a President Obama followed by a President Trump, because this is a repetition of history, as Ricky and Manuel already said. And if we recognize that it's a repetition of history, we know we have a fundamental set of problems that we have to address. They just keep repeating with new sets of complexities. For me, looking at our current situation, the three things that really stand out that I hope we can reorganize our narratives to address are around ideological diversity, around economic redistribution, and around the war machine. The votes that have happened seem to indicate to me that the Democratic Party has, for too long, taken this idea that there's some kind of ideological consensus among many of the populations and constituents of the Democratic Party. Speaking about the Asian American community, I can say that, yes, generally we tend to vote Democratic, but there are a lot of very conservative people in the Asian American community, possibly in the Latino community as well. And we need to be able to address that kind of ideological diversity in order to recognize who are our allies and who are not our allies. Just because we look like each other doesn't necessarily mean we're going to be on the same page. And that's where economic redistribution becomes really, really important. I think that part of one of the reasons I think that the Democratic Party message has failed to a certain extent is that people are not seeing the emphasis that's needed on economic redistribution. And then finally, the war machine. The question of Palestine, I think, was actually really critical to an electoral decision that was decided by hundreds of thousands of votes. Palestine is not an exception. Palestine is an indication of fundamental contradictions in the United States, how it addresses its domestic diversity and how it addresses its foreign policy. And pro-Palestinian supporters, I think, have been very right in pointing out not only the moral failure of the United States in supporting Israel and its policies of occupation, apartheid, and genocide, but also the failure of recognizing how those policies are tied to our own contradictions as an American society. Now, the last thing I have to say about California and the idea of resistance and solidarity is that I'm so happy that those keywords are still with us, resistance and solidarity. I find them much more useful than hope. Hope is a good emotion, kind of vacuous at the same time. I reflect on this because often I get surveys on surveys after I've gone to see a doctor or something and ask me, how do you feel about your experience? If I've had a positive experience with my doctor, I usually rarely actually answer that survey. If I've had a negative experience, then I get riled up. Then I go and fill out that survey, go to the barricades, as Manuel suggested. So I think the message of resistance and solidarity and struggle in this day and age is actually quite compelling, something that we should be amplifying, and something that hopefully would mobilize people perhaps a little bit more effectively than simply the positive message of hope.
I like that. Resistance and solidarity. All right. I like it. So says the writer. So I want to dig a little deeper, Sophia, and coming back to your comment around this notion that the access to health care was always political, right? Dismantling of public health is a political act. And you, as a global scholar working with local organizations and universities in Brazil and Kenya, Uganda, even Vietnam, how would you reflect on the question around the relationship between public health, politics, and democracy? Where do those land?
No, I appreciate that. And I think we're all just going to keep resonating on each other.
Yes, please.
In terms of different ways. So I want to kind of rush to the barricades in terms of this, but I also want to look at clarity of information and complexity, as Viet was suggesting, right? In terms of being able to think about how to talk about this. And I think one of the things that I think is really important is to be concrete about the examples that we look at, that we're not talking about something in the generic, in the kind of, this is what could be, this is what is. And I'd like to give another example, if I may, of a what is, because I do think it kind of shows exactly what we're talking about in terms of kind of what those relationships are. So just as one, I do a lot of work in HIV, have for a lot of my life. And, there's a new report that shows that, and you'll see exactly why I'm talking about this. There are 63 countries that currently criminalize same-sex sexual behaviors. And in those countries, HIV prevalence amongst gay men and men who have sex with men is 5 times higher than in countries that don't have these laws. Okay. And so start thinking about that in terms of democracy, right? So in Trump's first term in office, we know that there was this wave of discriminatory measures that aimed to limit protections for lesbian, gay, and transgender people across the US. And we know the states across the country have continued to pursue and pass these sorts of bills, and it's only going to get worse. But globally, what's important to remember is how Trump in the first term was so isolationist under the banner of America First and so transactional in his approach to foreign policy that he was unwilling to raise human rights concerns with foreign leaders or even express explicit support. So when we think about the intersection of the three things you're talking about, it's right there. And I just want to bring up Russia here, which, has put into place increasingly draconian measures against people who identify as lesbian or gay. It's not just that I raise that because the Trump administration isn't going to push back, but it's the implication of this, not only for vulnerable communities in Russia or in the United States, but how this is going to embolden efforts, particularly in countries that receive development aid from the US and or from Russia, to put back into place increasingly harmful legal environments for lesbians, for gay men, for transgender people, and more generally. And I'm tremendously concerned about those potentially devastating health and rights effects in countries around the globe. I hope that's responsive to you, Kim.
Yes, absolutely. And we know that there are over 300 anti-gay bills on the legislature floor today this year. So absolutely. And so, Ricky, your work also looks at the effectiveness of syringe exchange programs and interventions and strategies to reducing HIV among drug users and so forth. And you've written a lot about these communities and health disparities. Talk to us a little bit about, how those communities will be impacted by new policies of the incoming administration. What are some specific examples, if you have any?
Yeah, oh, sure. I mean, I think we see it in Prop 36, right? So which is a state initiative, so it's not even related to the Trump stuff. But this idea that you can punish your way out of substance use, has been shown to not work forever, really. I mean, we've spent my entire adult life doing it, and we don't, it doesn't yield the results that we want. I mean, I think the other issue is that there is so much discrimination and stigma against people that use drugs, and the federal tenor around responding to health problems in this population, really gets negative and reinforces that stigma approach, which is again also historically unsuccessful. So, it's a big step back. Um, I mean, I think the good news is that, the things that have worked for the populations that I study, like syringe service programs, like naloxone distribution, like safe supply, those things came from the community that was impacted, right? So PhDs in public health, physicians did not come up with any of those interventions. They came from the population, and I know in the meetings I have been in since then, and I've been in a few, there's a recognition that this is back to how we combated HIV, which is that we have to create the systems of care that take care of our people. And I guess my advice and the response I'm working on having. So what happened is recommitting to that first principle that the way you help people is give them the resources and the energies they need to help themselves. And I think in the harm reduction space, there's been a lot of developments in the last 3 decades where that population is they're under assault like they've never been, but they're also, more in solidarity with themselves and their allies to respond. And I'll just bring up an example. And this probably it's not in the United States, but it's a useful example. So I mentioned safe supply. So what do I mean by that? So, that is giving people who use opiates, and giving people who use meth, but giving them those drugs from pharmaceutically produced entities, and so it's safe and clean. You know what's in it. You know the potency, and when that's done, people don't die. And I know that because we've got decades of experience looking at heroin-assisted treatment, which had amazing outcomes. So what does that have to do with Vancouver? Well, the Drug User Liberation Front there began providing safe supply to people in that community with their own resources. And none of the people who were participating in that program died from overdoses, right? Because they were getting the solution, right? And there's so much more that we can do when we recognize that, what makes people vulnerable is disempowerment. What makes people vulnerable is a decision that the rest of us make that the only way to help them is to hurt them. And that happens over and over and over again. And, I think it has big implications for reproductive health. I mean, we see that with how they're trying to deal with those issues. And
Mhm.
so, I mean, I think the answer is that we have to be clear who we're in solidarity with, where we stand, and then get back to business. Get back on the barricades, get back volunteering with the Shrimp Service Program. You
Mhm.
know,
Mhm.
giving
Mhm.
it out in the lock zone. Helping people get housed, like just doing the work because we do have the solutions. I mean, I think that's the biggest take home always. They talk about dead ends, dead enders. I mean, that's the Trump agenda. It's a dead end,
Mhm.
figuratively and metaphorically. I mean, but literally and figuratively, right? It's a dead end for all of the
Yeah.
problems that we have.
Yeah.
And so we just have to redouble our efforts on the local level and national level, wherever we can, to be part of the solutions that we know work.
Yeah, and I love what you said, that the people most impacted must be centered in finding the solutions. I think people forget that, and it's not necessarily done outside in some other different sphere. So thank you for lifting that up. And so, Manuel, coming back to your comments around the immigrant communities here, particularly here in California, but across the country as well. We know that that's something that you do well, really disaggregating the data, and so people can feel very seen in the data that you share. And most recently, you did this Rock the Naturalization Vote, which highlighted the number of immigrants that became citizens and were expected to vote in this past election. Can you talk a little bit about what community partners you worked with that will utilize this data and its possible impact on the past election? You're on mute though, so.
That was a project where we tried to figure out who had recently naturalized and helped to work with the National Partnership of New Americans, a group of statewide immigrant rights groups, on where these voters were and how they might be motivated to uh, vote. And I think that kind of gets to my sneaky thing of answering your question with a couple of other points, which is that that was kind of unique. I mean, we provided data, but I think one of our tasks right now is how do we combine science with spirit? So we know from what Ricky is saying what works, but we don't do it because we don't see people who are drug users as human beings. We don't see homeless individuals as part of our human family. People see immigrants as others. And so we need to be doing the science, providing data to mobilize voters, but also the stories and the connections that bring people together. I think two other things that I think are important in this moment. Uh, Viet talked about resistance, and I think that's important. But we need to be combining resistance with renewal. We need to be not just saying what's bad, but showing what works, getting things right. For example, in our state of California, and making sure that things are livable here, that people are seeing their livelihoods improve. So we can say that this is the future that you want, that you shouldn't be scared of. And I think that's part of what the left needs to do a little bit better is not just critique, but propose, demonstrate, and show what else is there. I've got one other thing to say, but I'll bring it in at the end so that I don't eat
Okay.
up too much time.
Okay, all right. And I just want to follow up with a last question for Viet, and then we can take some questions from the chat if folks have questions. And so if you are on this call, hopefully you would have read some of his New York bestseller, New York Times bestselling books, right? But this is a time of many of us are really experiencing grief in different ways. And of course, not to overshadow what's currently happening in South Korea, where the parliament voted unanimously against the president's call to impose martial law, right? That was recently revoked. So, as someone who writes a lot about their culture, among other things, can you talk to us as a writer on ways we might use writing, particularly the students that are listening in, that we might use writing to manage the plethora of emotions so many of us are feeling post-elections?
I like to say that if I wasn't a writer, I'd be a priest because I think that they're very related. They're both disciplines that require sacrifice, struggle, hope, faith, delusion, things like this. And the work of becoming a writer, I think, has been very useful to me in at least two ways to answer your question. You brought up the example of South Korea, and much of my work is about memory and forgetting and history and so on. If we look at the declaration of martial law in South Korea, we might think, well, that's just something about South Koreans. I mean, the last time martial law was declared in South Korea, the South Korean government massacred civilians in Gwangju during a democratic uprising. The president in charge was a veteran of the Vietnam War. South Korea had sent 300,000 troops into Vietnam. And our history is deeply tied in with that because American payments to South Korea for its troops and its contractors helped transform South Korea into the powerhouse it is today. So the work of writing and scholarship is so crucial to the act of memory and forgetting and providing us with a history for our hope. I do believe in hope. I don't want to be a negative person about that. But the reason why hope itself is vacuous is because you have to have a sense of history in order to give meaning to hope. Hope by itself is meaningless unless we understand the history. And so if we just looked at what happened in South Korea without an understanding of the history, we don't actually understand how our own history as Americans, my own history as a Vietnamese person, is actually tied in to that martial law declaration. Now, the other thing about being a writer that gives me hope is that when I looked at all of the emotions initially that people put forward, I was like, oh my God, angry, sad, anxious, worried, uncertain, etc. I go through those feelings every day as a writer. And I think I'm probably speaking for a lot of writers. We deal with this every day. How do we overcome that? We overcome that through discipline. We write every day, or we write every week, or we write a certain number of hours every year. We face the blank, we face the blank page, the hopelessness of that blank page. And there's nothing easy about it. You start off writing 5-page papers, and you write 20-page papers, then you write 200-page dissertations, and then you write 400-page novels. But in order to get to that, you have to write every day, or you have to do something of that sort every day. And so that model of using discipline, suffering, endurance, I think, for writing is also applicable to our struggles over narrative and our struggles over the narrative of this country, right? People out there like Manuel who've been doing this their entire lifetime, like, yeah, I'm going to lead a revolutionary movement. I do this every day. But people are just being awakened to the political crisis of this country and are feeling overwhelmed. Look, you take it one page, one sentence, one action at a time. That gives me hope that we can build upon those sentences and actions that would lead to a greater struggle and movement.
Yeah, thank you for that. I want to just share a short personal thing about writing. Recently, my son, who's away at school in Missouri, lost a teammate in a car accident, and the teachers all asked him to do some writing about it. And he wrote this beautiful essay about the relationship with his friend and how he would be missed. And I thought that that was so cathartic for him, to put all of his feelings and thoughts down. And so I just want to offer that to the students listening, that is definitely one of the ways to get through this difficult time that we're in now. So I want to pause just for a second and look at a couple of questions that had come in from the chat. So the first one I will ask is, and anyone can jump in to answer, how can community organizations address fear people may not have about participating in health programs and health advocacy efforts? How can the organizations address the fear that Manuel was mentioning earlier?
I'll go, but I, I, by not shying away from it and by giving people the space to express it. And I think that we're all feeling this right now. And I think it's extremely important that people have the opportunity to say that those feelings are validated and that it's clear why people are feeling that way. And if those community services are in California, to recognize the incredible privilege we have of being in California, where the governor has said specifically that we will be protected if we're trying to make health services available to people. Whether it turns out that way, whole other story. But that's where we are right now. So that's my initial thought, just to try to give some sort of response.
Thank you. Thank you. Another question. Sorry, go ahead, Bit.
I was just going to say, like, it's not specifically about this issue, but in general about fear. It's
Mm-hmm.
so important to raise our voices, to be visible, to be audible, to let people know that there are other people like them that are out there, and to express our solidarity. When one person is victimized or when one person is attacked, then we all have to stand up for that person or that community, as Ricky also said as well. Those public demonstrations of our beliefs allow other people who are feeling fear to possibly find some courage in themselves.
Yeah. And that's another question that came up in the chat. How can students exercise their civic duty and express free speech and protest within changing institutions and shifting political environment? I know this is a sensitive topic for universities in general, but what are some thoughts there to the students wanting to exercise civic duty?
Well, I mean, I think, I guess my response to this is there's lots of ways to exercise your civic duty, and one of them is, that sort of mutual aid space that is also can be also very powerful, and communicates directly and addresses directly the needs that people have. And you can apply that to the Gaza Israel thing, you can apply that to reproductive health, you could apply that to drug users, you can apply that to immigrants, and people have been doing that. I mean, the stories about people being bused to Chicago and New York from Florida and Texas. There's been an enormous mutual aid response to those communities and efforts to try and be hospitable to the new neighbors that people have and try and make a way. And so, I've been in my share of protests over the year, and I've done a lot of mutual aid work, and I do think there's more cover for mutual aid work in a way, because the protest is implied, right? And at the same time, you're doing work that's really needed to
Mhm.
help people who are suffering.
Thank you. Well, we are winding up, and so I want to just give each person like a minute and a half just to share, how do we win back our power? What is your call to action for each of the persons listening in? How can we support the communities that are most impacted? What's one thing you want to leave folks with that they can do? And let's start with Sophia.
Okay. All right. All right. There's that Tim Snyder quote that's going around, and I kind of want to read it out loud because in some ways it is kind of that call to action in a way. And I'm sure people have been seeing this, which is do not obey in advance. Most of the power of authoritarianism is freely given. In times like these, individuals think ahead about what a more repressive government will want and then offer themselves without being asked. A citizen who adapts in this way is teaching power what it can do. And I think that comes back to then thinking about being not uncomfortable, not shying away from hard topics, but engaging them directly. It's ensuring that we actually take these things on head on. And I just need to make the plea that we don't think about the global as something out there, but we think about the global in terms of the connections that we all have in these intersections so that we are generous with one another and recognize that there are fears that people are feeling, really strong fears people outside the US are facing about what's happening right here as well. So it's about bringing those people together. And then just to say, look, I'm trying to move towards being pragmatic. I'm trying to move towards being positive. I'm trying to see this period as interesting and a challenge. I'm not, to be very honest, quite there yet, but I'm really trying. So I hope we can all try.
Thank you. Ricky, a minute and a half. What's your call to action?
Well, I'm glad Sophia had to go first. And unfortunately, it didn't help me other than, what I've said already. I mean, I do think, engage with the people that you care about. Community is more important now than ever. It's also always the solution. But, when we make common cause and see ourselves and others, that's how we solve the problems that we have. And I meant it when I said, what Trump is up to and people who support him, it's a dead end. It is not a solution to anything. It's just more war and suffering and pain and enrichment of a very few people. And so our response has to be to link arms with others in practical and political ways where appropriate, and create the new society that we want to be in. And appreciate all of the strengths that we already have, to make that happen.
Yeah, how about you? Minute and a half. What's your call to action?
I think back to that great white male American writer, F. Scott Fitzgerald, who said that the sign of a first-rate intelligence is to be able to hold two opposing ideas in your mind at the same time. It's actually really difficult to do. That's why I started off with my comments about beauty and brutality, because there are a lot of Americans who don't want to hold those two opposing ideas in their mind at the same time. They want one thing or the other. And it's true not just for our opponents, whoever those may be, but it's true for those on our own side as well. And I think for me, instead of having some kind of pragmatic, solution to what everybody's been discussing, for me, it's a more personal solution. This idea of holding two opposing ideas at the same time. I'll give you one example. I've spoken a lot about the necessity of having a voice, of raising your voice, of speaking out. Absolutely crucial. But crucial also at the same time is what you did at the beginning, Kim, which is ask us to take a deep breath, to contemplate, to feel our inner calm. I think you have to be able to do at least those two things at the same time. Be outspoken, be loud, be angry, be righteous in your conviction, and yet have a space of meditation and calm where you know yourself and who you are. This is a time for all of us to find out who we authentically are, what we believe in, what is at our core, in order to keep ourselves steady for the turbulent struggles that lay ahead. And I learned my lesson from the previous Trump administration because I was loud and angry, and I think I was right, but I also allowed myself to be too much moved by the spectacle of Trump and what he said and what he believed in. I refused to allow myself to be so moved this time. I
Mhm.
still have my same convictions. I still have my same passions, and I'm so angry, but I'm not, I never allow myself to hate, to repeat in the mirror the spectacle of that which I disagree with and which I think does not belong in any kind of progressive and hopeful society.
Absolutely. We cannot take on the habits of folks that practice white supremacy. I absolutely agree there. Manuel, close us out with your call to action.
After the Los Angeles civil unrest, which was another earthquake that revealed the fault lines in our society, there was someone who realized and commented, many of us in the field, that if you have a city that's pissed off enough to burn itself down, and you haven't been able to channel that into something more productive in terms of social change, there's not just something wrong with the system or the other side. There's something wrong with you. And what I would ask those of us who are fearful, traumatized, wondering about the selection is not just to point the finger, but to look in the mirror and say, what do we need to do about our economic narrative? What do we need to do about bridge building? What do we need to do about combining the data driven stories with a spirit driven narrative? What do we need to do to hold two ideas in our head at the same time? Because as much as this might be a failure of America, it's a failure of ours. In a world where the climate is at risk, in a world where there's this much inequality, in a world where there's this much baked in racism, in a world on fire, why are people throwing firewood? And why can't we get people together to do something different? This is a time for feeling, for thinking, for rethinking.
Thank you so much. Give some love in the chat, y'all, for this amazing panelist. If we were in person, we'd be clapping it up. Come on, let's see some claps in the chat. All right, thank you all. The call to actions were clear, engage directly with folks and know that we're connected globally and engage, link arms, definitely hold to opposing ideas. Remember to breathe, breathe, breathe. There are lots of free meditation spaces, y'all. USC has them too. Looking in the mirror and asking, how do I bridge? How can we combine data and spirit narrative? Feel, 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 think, 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 rethink, rethink, rethink. Thanks to the team at ERI for hosting this webinar with all the behind the scenes work. Thank you to the collaborating USC departments, the Department of Population and Public Health, the Institute on Inequalities in Global Health, and the American Studies and Ethnicity. Thank you to the students, the faculty, the staff, the community members that joined virtually. I hope you got something from today's conversation that will allow you to feel empowered in your work around social and health equity. As our ancestor Audre Lorde once said in her work, there is no such thing as single issue struggle because we do not live single issue lives. Let us continue to support one another in our work. Thank you, everyone. Have a good rest of your week. Take care, everybody.